Hello, everyone, and welcome to today's session. And today we'll be discussing the NCERT exercise for the chapter Reproductive Health. This is the part one of the lecture. So, in this lecture, we'll discuss some of the NCERT exercises, and rest of the NCERT exercise we'll discuss in the next session. Before starting this lecture, I just want to give you one information that the images, text, and other materials used in the presentations are for education purposes only. We respect the intellectual property rights of the original creators and owners. If you are the owner and have any concerns or issues, please contact us at sathee@iitk.ac.in and we shall remove the content immediately. Please note that parts of the content may have been generated using generative AI, which is experimental. So, what are the objectives of today's session? So, we will explore and understand the fundamental concepts of the chapter 3, which is reproductive health, by working through the NCERT exercises. So these exercises, they are based on some concepts. So we will understand these basic concepts by discussing these exercises. Okay, so we will discuss question number 1 to question number 6 in this session. So let's begin with this question now. What do you think is the significance of reproductive health in the society? So you can get the answer for this question in the NCERT section 3.1. Okay, so what is the importance of reproductive health in the society? This is the question. So let's have a look at the answer for this question now. So what is the significance of reproductive health? Number one, it ensures safe reproductive life and overall well-being. So when the individuals in the society, they are healthy, okay, this means they are physically fit, they are emotionally fit, okay, they have a behavioral well-being, means they are behaving normally in the society, they are emotionally stable, okay. So physically they are healthy means their reproductive organs are functioning normally, so they will have safe reproductive life and they will have overall well-being. Overall well-being means they will be emotionally stable, behaviorally they will stable, okay, physically they will be stable, mentally also they will be stable. So overall they will be healthy. Next, they help in population control through family planning. So if the society is reproductively healthy, this means they are doing the family planning. Okay, for the family planning, they are using contraceptive devices. And these contraceptive devices helps in the population control. And what happens when you keep space between the children's? Then the mother's health as well as the child health, both will be better. Okay. So you can say the individuals will be reproductively healthy. Now, prevent STDs and HIV or AIDS through awareness. So, again, what is the importance of reproductive health? So, it can prevent the transmission of the sexually transmitted diseases, because that society will be aware of the consequences of STD or how to prevent this spread of these STDs. They'll be knowing about the use of contraceptive devices. So, this will prevent the spread of STDs such as AIDS, which is most dangerous STD, because they will be aware of the consequences of these diseases. Then there will be reduced maternal and infant mortality. So maternal is the term related to mother, infant is the term related to the newborn. Mortality means the death rate. So there will be reduction in the maternal and the infant death rate. The next one promotes gender equality and women's empowerment. Okay. So gender equality means equal importance is given to both the girl child and the male child. And this also ensures women's empowerment. Okay. So the society, if the individual of society, they are reproductively healthy, this means they are aware of the sex ratio also. So sex ratio should be maintained in the society. Okay. And they maintain the gender equality. So sometimes what happens, if the parents, they come to know it is a girl, they abort that girl. And this is known as female feticides. So this disturbs the sex ratio in the society. Okay. Supports economic development through family planning. This is also very important. So through family planning, the parents or the couples, they can keep space between the childrens. Sometimes the parents, they don't have enough money to support the child. Okay. So by preventing unwanted pregnancies and through family planning, okay, what they can do, they can better support their families by having only one children. If they have 2 or 3 children, then they are not able to support them because they don't have enough money, they don't have enough resources. So it supports economic development through family planning. If they have only one child, so they can easily provide all the resources to that one child. Prevent teenage pregnancies and promote reproductive hygiene. So when a society is aware of safe sexual practices, if they are aware of the use of contraceptive devices, then this can prevent teenage pregnancies, because individuals in the age of 15 to 24, they are very vulnerable. Okay. They are very curious. They want to try new things and they are not aware of the contraceptive methods. So it prevents the teenage pregnancy also and promote reproductive hygiene. So this is also very important significance of maintaining reproductive health. Okay, so here you can see this is a image showing you family planning. A small family is a happy family. Now let's discuss this question. Suggest the aspects of reproductive health which need to be given special attention in the present scenario. So what are the areas, okay, of the reproductive health which needs to be given special attention in the present scenario? What areas need improvement? Okay. So what will be the answer to this question? So let's discuss the answer. So the different aspects that require special attention are as follows. First of all, there should be awareness. Awareness needs to be created in reproductive and child health care. So awareness should be spread regarding safe sexual practices. Awareness should be spread regarding the this sex education. Awareness should be spread regarding use of contraceptive devices, regarding family planning, regarding, you can say, prenatal care and postnatal care of the mother. Prenatal care means during the pregnancy. Postnatal care means after the birth of the child. Care should be taken during the pregnancy also. Okay. Then how to take care of the child. The importance of breastfeeding should also be told to them. Because awareness needs to be created in reproductive and child health care. Okay. Then creating awareness among people by counseling about reproductive organs, adolescence, safe sexual practices, and different STDs such as AIDS. So counseling should be given to the couples or the individuals in the marriageable age. And also counseling should be given to the individuals which are in the age of 15 to 24. Or you can see individuals which are in the adolescence phase. Okay. So awareness and counseling should be given to them. Regarding what? Regarding the reproductive organs. So whenever the male or the female, they attain puberty, so there are a lot of changes in their body. There are a lot of morphological change, there are a lot of physiological change. There are changes in the reproductive organs also. So they should be made aware what is happening to their body. Okay. Then counseling should be given to adolescents individuals, adolescents people. Again, they are undergoing a lot of changes and they are very curious. They want to try new things. So they should be given counseling and they should be made aware of safe sexual practices. Okay. And then information should be given regarding the sexually transmitted diseases, how to prevent the spread of STDs. Information should be given regarding this sexually transmitted disease as well, such as AIDS. Introduce sex education in the schools. So sex education should be introduced in the schools. Again, you can say the individuals, the youth, you can say, or the individuals in the age of 15 to 24, okay, or the students in the school, they should be given sex education. So they should be told, they should be informed, they should be made aware of the various contraceptive devices and the safe sexual practices. Okay, now, fourth one is help eradicate myths and misconception. So there are a lot of myths and misconception related to sex related issues or regarding the reproduction related issues. So these myths and misconceptions should be eradicated. Now, educate about birth control, pregnancy care, and breastfeeding. So awareness should be spread regarding the birth control measures. So birth control measures means contraceptive devices. So there are various categories of contraceptives. So there were natural methods, there were barrier methods, and IUDs, then oral pills, injectables, implants, and surgical methods. These are the various categories of contraceptives. Information should be given to them. Information should also be provided to the couples. Okay. So they should be told which contraceptive will be effective for them. If they want to if they want to keep space between the children's, which contraceptive device they should use. Okay, so the medical professional people, they should give information. They should give counseling to these couples. Okay. Pregnancy care information should be given regarding the pregnancy care. During the pregnancy, the female body undergoes a lot of changes. Okay. There are a lot of physiological changes in the woman's body. And the care of the mother should be taken during the pregnancy because the mother is under a lot of stress also. She is under a lot of pain also. And she has to feed the young one also that is developing inside the womb. Okay, so pregnancy care information regarding the pregnancy care should be taken. So this comes under the prenatal care. And awareness regarding the breastfeeding should also be done. So mother's milk, which is known as the colostrum, this is very nutritious. It consists of a lot of, you can say, nutrients and vitamins such as vitamin A, vitamin K, and vitamin B12. Okay. So this mother's milk also consists of antibodies, which are immunoglobulins. Which antibody it consists? It consists of immunoglobulin A. which helps to develop resistance in the newborn against the pathogens. So information regarding the importance of breastfeeding should also be given. Now, provide professional expertise and medical assistance. So healthcare facilities should be good, infrastructure should be good. The counseling should be done by medical professional people. Okay, and proper medical assistance should be given. Okay. All the, you can say, materials should be available. The medicines, the contraceptive pills should be available. Okay. All the contraceptive devices, they should be available. Now, raise awareness about family planning and sex-related crimes. So awareness should be spread about the importance of family planning, that why you should keep space between the children. So keeping space between the children will help the parents, okay, to provide all the resources to the child. It will also enhance the maternal and the fetal, maternal health as well as the health of the newborn. Then awareness should be spread regarding the sex-related crimes. Okay. So this is a slogan that is given. This is a family planning slogan. Hum do hamare do. Or small family is a happy family. The next question is sex education necessary in schools? And if it is necessary, why it is necessary in the schools? So you can get the answer of this question from the section 3.1. So you should read section 3.1 if you want more information regarding the sex education. So what will be the answer for this question? Let's have a look at the answer to this question. The sex education is necessary in schools as it prevent misconception and myths about sex. So there are a lot of misconceptions, there are a lot of myths regarding the, you can say, sex or reproduction related issues. So introduction of the sex education in the schools will help eradicate the misconceptions and myths regarding the sex related issues. Okay. Now, teaches about adolescence and reproductive organs. So why sex education necessary? It tells you about the changes that occurs in the body during the adolescence. So adolescence is a time period. It is a phase of life during which a lot of morphological and physiological changes occur in the individual. And information is also given regarding the reproductive organs, because the reproductive organs, they become active at puberty. Okay. And the hormones are released. These hormones, they help in the development of secondary sexual characteristics. So by implementing sex education in the schools, or giving information regarding the changes during the adolescence and reproductive organs, one can achieve reproductive healthy society as well. Now, why is sex education necessary in schools? Again, it promotes safe sexual practices, because information is given regarding the use of contraceptives and safe sexual practices. So it promotes safe sexual practices, and this will also prevent the spread of sexually transmitted diseases, because the individual in the adolescence phase, they are very vulnerable to these STDs, because they want to try new things and they indulge in wrong activities. Then educates about sexually transmitted diseases. So it educates about the spread of sexually transmitted, how they are spread, and what you can do to prevent the spread of sexually transmitted diseases. So information is given regarding this also. Okay, so these sexually transmitted diseases, if they are diagnosed early, if they are detected early, then they can be completely cured. So the bacterial infections or the infection caused by protozoans or by yeast, they can be cured. But the STDs which are caused by viruses, such as herpes and hepatitis B and HIV, they are not completely cured. Now, it ensures healthy reproductive life. So, obviously, if the person is aware of safe sexual practices, if the person is aware of the changes going on in his or her body, then the person can lead a healthy reproductive life. So, sex education should be mandatory in the schools. So, schools need sex education. Now, let's discuss this question. Do you think that reproductive health in our country has improved in the past 50 years? And if yes, mention some areas of improvement. So a lot of initiatives has been taken by government to improve the reproductive health of the individuals, to improve the reproductive health of the society. Okay, so these initiatives are like family planning and the RCH program. Okay, so if you think the reproductive health of our country has improved, then you have to mention some areas of improvement. Still, some areas have been neglected. So you have to mention those areas which needs further improvement. For this, you can read NCERT section 3.1 and 3.2. So what will be the answer to this question? Now let's have a look at the answer. Yes, there is certainly been an enormous improvement in reproductive health in the past 50 years. So reproductive health of the individuals have enhanced significantly in the past 50 years. So a lot of initiatives has been taken by the government, and the society is more aware now, okay, about the reproduction related issues, about the sex related issues. So this has led to the improvement in the reproductive health of the society. Okay, but there are some areas which needs improvement. So listed below are the areas of improvement. What are the areas of improvement? First one is infant mortality rate remains high and needs improvement through expanded child immunization programs. So infant mortality rates means death of the newborn. So death of the newborn still remains high. Still a large number of newborns, they die. So this area needs improvement. Okay, through what? How this can be achieved? This can be achieved through child immunization program. So there are a lot of child immunization programs means vaccination programs. So a lot of vaccines are available now for the newborns as well. So the child should be immunized. The child should be vaccinated. And there are vaccines available for the sexually transmitted disease also, such as HPV and hepatitis B. Okay, so this will help reduce the infant death rate. Now, postnatal care is very important. Postnatal care means after the birth of the child. So care should be taken of both the mother as well as the newborn. Postnatal care facilities and services need enhancement to further reduce maternal and infant mortality rates. Okay, so our healthcare system should be better. Postnatal care facilities and services need improvement. This will also help to reduce mother and the infant death rate. Now, family planning programs. This require wider reach and better implementation to promote awareness about family size management. The family planning was initiated in India also. Okay. Now, this family planning requires wider reach and better implementation also. So, more people should be made aware of the family planning programs. Now, government is also promoting family planning, and government is giving even incentives also. Government is giving monetary benefit to the couples who are going for the smaller families. So, these areas need improvement. Still, the population of the world and the India, it is rising. Okay. So family planning is very important. Family size management is very important. Okay. So now what they are doing, especially the couples in the urban areas, they have adopted the one norm child. But still in the rural areas, there is, you can say, very limited awareness of the family planning programs. Then next one, number 4 is prevention and control of STDs. This needs strengthening along with improved access to contraceptives. So the number of cases of sexually transmitted disease, they are rising. Okay. So awareness should be spread regarding the prevention of the spread of the STDs. Okay. So this area also needs strengthening, and awareness should also be spread regarding the use of contraceptives, because contraceptives such as condom, this helps to prevent the spread of the diseases. Because what condoms do, condoms, they cover the reproductive organs. Male condoms, they cover the penis, and female condom, they cover the cervix and the vagina. And this sexually transmitted disease, they are spread through the body fluids during the sexual intercourse. So the body fluids, semen and the vaginal secretion, they are not able to enter into the reproductive tract. Here, there should be improved access also to the contraceptives. So these contraceptives should be made easily available to the individuals. Now let's discuss this question. This is question number 5 of the NCERT exercise. Now, what are the suggested reasons for population explosion? So population explosion is happening. Okay, what do you mean by population explosion? There is a rapid increase in the population size. So the growth rate is very high. Okay, earlier the growth rate was 2%. Okay. So what are the reasons for the population explosion? So to get the answer of this question, you can read the section you can read the NCERT section 3.2. Now, what will be the answer to this question? So let's have a look at the answer now. The population explosion can be used to refer to the sudden large increase in the size of the population. Or simply you can say population explosion is a rapid increase in the population size. Okay. That's why it is written sudden. Or you can write rapid, large increase in the size of the population. Now, what are the reasons of population explosion? Now, basically, there are two major reasons for the population explosion. First one, there is an increase in the birth rate and the longevity of the people. Okay. What do you mean by longevity of the people? Now, the people, they have larger lifespan. They are living more. Okay. Like in countries like Japan, the average lifespan is around, it has reached around 80. Okay, so longevity has also increased. Less people are dying. And the birth rate is also more. There is a decrease in mortality also. And there is increase in the birth rate, which is natality. So this is the first reason, increase in the birth rate and the longevity. Next one, decrease in the death rate. means decrease in the mortality. Now, why there is an increase in the birth rate and why there is a decrease in the death rate? So let's have a look at this now. So because of improved healthcare facilities and because of reproductive awareness, this has led to lower death rates and higher birth rates. So the lifestyle is better now. The healthcare facilities are better. We have better infrastructure now. Okay. We have a lot of medical professional peoples that are counseling the couples regarding reproductive related issues. There is better prenatal care. There is better postnatal care also. Okay. People are more aware also now about the safe sexual practices. They are now aware of the sexually transmitted diseases. The healthcare system has, you can say, improved significantly. There is reproductive awareness. Now the people, they know about the contraceptive devices. They know about the safe sexual practices. So this has led to lower death rate and there is a higher birth rate now. Means less people are dying. Okay, there is a reduction in the maternal mortality rate and infant mortality rate as well. Okay, and there is a higher birth rate also. Okay. Now, why there is a higher birth rate? Because there is an enhancement in the people who are in the marriageable age. If there are more people in the marriageable age, then obviously they will produce more, you can say, children's. Okay, more children's means there is a rise in the population size. Okay, and now less newborn they are dying because of better healthcare facilities now. Okay, so this is also one of the reason more people in the marriageable age. This can also lead to increase in the population size. Okay, for example, China. In China, one child policy was there. Okay. Now, what is happened in China? Most of the population in China, they are old now, and their population is decreasing because the number of individuals in the reproductive age, they are less. In India, the population is still expanding because Indian population is quite young now. The average age of Indian, this is around 25 to between 30. Okay, so now the more number of individuals are in the marriageable age in India. So India's population is still rising, whereas the population of China, this is decreasing because more number of individuals are older now. Okay, or they are very young. Okay, now measures taken to introduce sex education topic at school level and better medical facilities. Now the sex education has been introduced in the schools. Okay, and there are better medical facilities, obviously. So this has led to lower death rates and higher birth rates. Okay, ensuring food supply and medical assistance during emergency times and so on. So the care is taken of the mother during the pregnancy and after the pregnancy also. There is enough food supply, means the, you can say, the nutritional care of the mother is also taken care of. Okay, if the mother is having enough food, the mother is having good food, okay, nutritious food, then the mother will be healthy and the child will also be healthy because the child is dependent on the mother. And there is a better medical assistance also during emergency times. Okay. Now, these reasons have also led to an increase in longevity of the people. Longevity of the people means now the people, they are living, you can say, up to a, or their lifespan has increased. Okay. Now let's discuss this question. Question number 6. What is the use of contraceptive justified? You have to give reasons. So these contraceptive methods, they are known as the birth control methods. So there are various categories of contraceptive methods, such as natural methods and then barrier methods. Then there are these IUDs, intrauterine devices, which are inserted into the uterus. Then there are injectables, implants, oral pills, and surgical methods. So you have to explain here, is the use of contraceptives justified or to prevent the unwanted pregnancies? And you have to give reasons. So for the answer of this question, you can read the section 3.2, population explosion and birth control. So what will be the answer to this question? Now, yes, the use of contraceptives is completely justified. Okay. These contraceptives, they help in family planning. They help to keep space between the children. They prevent unwanted pregnancies. Okay. Contraceptive can be used to prevent pregnancy in the case of sexual abuse, such as rape. Contraceptives, okay, such as condom, it also helps to reduce the spread of sexually transmitted diseases. So their use is completely justified. The human population is increasing exponentially. Exponential means there is a rapid increase in the population. So this population needs to be controlled. Although government has introduced a lot of programs such as family planning program and RCH program. Okay, government and non-governmental agencies both are working in this field to control the population size. But these programs, they are not that successful. The population is still not under control. Okay, so population is increasing exponentially. In order to regulate this population growth, keeping a check on the process of reproduction has become a need of the hour. So how can you regulate the population growth? How you can regulate the increasing population size? So you have to keep check on the process of the reproduction, because by reproduction new individuals are produced. So reproduction needs to be checked. How you can check the reproduction? So for this purpose, different contraceptive devices have been circulated for use to reduce the unwanted pregnancies, which have helped to lessen the recorded count of birth rate, thereby regulating the process of population explosion. So by the use of these contraceptives, unwanted pregnancies can be reduced. Okay. And this will obviously lead to decrease in the birth rate. Okay. And thereby regulating the process of population explosion. So by the use of contraceptives, population size can be controlled, population growth can be controlled, because this contraceptive device, all of these contraceptive devices, they prevent the fertilization. Okay. If there is no fertilization, no zygote is produced, no embryo is produced. Okay. So these contraceptives, they play a major role in controlling the population size. Okay, so we have discussed 6 questions here, 6 NCERT questions. We will discuss the rest of the questions in the next session. Okay. So I hope this session was quite knowledgeable for you. We'll meet you in the next session. Thank you very much for listening.